Okay guys, so we're gonna do a laparoscopic cholecystectomy on my best friend's little brother. So it's probably gonna be the fastest one you've ever seen. So I've already set my table, I've already done a full count of sponges and sharps and instruments. We are in supine with, eventually we're gonna do slight reverse Trendelenburg with general anesthesia. We have prepped with core prep from the chest to the suprapubic area and down the sides to the table. We have squared off with 4 towels and cords have been thrown off. So right now we will inject local. Depending on surgeon, depends on what kind of local you want. We are using 1% lidocaine with epi. Don't have a needle, but we're gonna act like it anyway. So we will inject 5 cc's into the belly button. We will make our incision into the belly button. And we're going to use our Kelly to go in and separate the fascia. We will use our suture, don't have any suture. We will use 0 vicryl to attach onto the fascia. We will then take a trocar, Hassan trocar, we'll stick it in. We will attach the vicryl to the sides of the trocar, and that's going to anchor it down into the abdomen. We will then insert the camera and scope into the umbilicus and then we will then insufflate the abdomen with CO2 so the surgeon will have a better view. Once the abdomen is as full as the surgeon wants it, he will then mark his other spots with lidocaine. So we are going to put a spot in midline. We'll do 5 cc's. We'll make our incision, and we will stick another trocar in, 5mm trocar. We will go in and we will do 2 more incisions. One we'll do in the right subcostal, and then one we'll do right lower quadrant. So we have all of our trocars in. We have our 10mm camera in. I don't think anesthesia is working very well over here. And we will look at the gallbladder, examine the gallbladder, make sure that it is inflamed, look at the liver, make sure everything's okay. We will then insert 2 graspers into the right lower quadrant and right subcostal. And the surgeon will have the camera in the belly button and his bogey hook or Maryland in the midline trocar. We will then attach the graspers to the gallbladder for retraction. The surgeon will then dissect the cystic artery and cystic duct away from the liver. With the bogey, we will take the 10mm camera out. We will switch it out with a 5mm. We'll put it in the midline trocar. We will then insert the hemoclip applier into the Hassan trocar. We will put a clip on the cystic artery and a clip on the cystic duct. We will do 2 on one side and 1 on the other of each. We will then insert the scissors into the belly button and cut in between the clips. Then we will insert the, I've done lost my train of thought. We'll insert the bag, the endo catch bag, into the belly button, and then we will, that's after we've done dissected gallbladder away from the liver, we'll insert the bag. We'll take the gallbladder, drop it in the bag. We'll pull the strings of the bag. We'll pull the gallbladder out of the belly button. We will then look at the abdomen, make sure the liver's okay, make sure all the surrounding anatomy is okay. We will then insert the suction irrigator, and we will irrigate and we'll suction. mask is coming off. And we will then pull everything out. We will deflate the stomach by pushing on it, getting everything out. We will then go to close up. We will use 4-0 Vicryl on all of the surrounding incisions on the belly button. We will use the Vicryl that we had in the fascia to hold the trocar. We will then use a wet and dry. We'll clean everything up. We will then put Dermabond on each incision site. We will put a belly button ball inside the belly button with a Tegaderm, and we will move the patient to PACU for further, that's the word I'm looking for, and further evaluation. And that's it. We're done. Good job, guys.